Hey, well, want to say good morning to everybody in the Yuba and Sutter area. And we're saying this for Yuba Sutter because we're here today with Dr. Phuong Luu. Dr. Luu, of course, is our newest health expert for the Yuba Sutter area, our health officer that represents Yuba and Sutter counties both. And so we're here today. She has a topic. I know people have been kind of watching the news, watching information about the coronavirus and how the media kind of pushes the information to us. Well, we think it's important for um, our resident expert to kind of weigh in, to kind of give perspective on it. She's been talking to us about it. She's really wanted to approach the entire community, the two counties, and our residents and talk to you folks. So anyway, we're going to turn it back over to her and let her. Let me push it over. Is it? There you go.
Your finger might be too big.
You think my finger's too big? Is that what, all right, we found her. Anyway.
Hi. Good morning.
Good morning, Dr. Luu. Now, how long have you been with you in Sutter County so far?
So this is my third week. So I started January 13th, 2020.
Okay. Well, welcome.
Thank
We're
you.
excited. And Dr. Luu, you approached us to when the information started coming out about the coronavirus and some of the concerns out there. And I'm sure people in the community have been reaching out to you and asking questions. And so this is an opportunity to. What are you seeing out there with the advent of this information coming in and how things are unfolding, both on the global scale and bringing it down to the local level eventually?
Yeah, so this situation with the novel coronavirus, first of all, I want to step back and say that it was initially diagnosed in Wuhan City, China in late December 2019. Currently, as of this morning, the global concern is very serious. We have now over nearly 6,000 cases positive throughout China and in several countries globally. There's 130 deaths. However, the risk in terms of the U.S. and especially for the U.S. Sutter County by county region is very low.
Okay, so and people are being concerned about it feels almost like in the media this rapid spread and this danger at the doorstep.
Mm-hmm.
How should people be looking at this?
Yeah, so I don't think that the community needs to be overly concerned. So the highest risk populations are going to be those in mainland China. And then the second highest risk would be people who have recently traveled to mainland China and return. So if you don't interact with anyone who has returned from traveling to mainland China or coming from mainland China in the recent weeks, your risk of being exposed to this novel coronavirus is very, very low. The best way in terms of prevention of any viral infection, whether it be the flu or the novel coronavirus, is what your grandmother, your mother always tells you. Wash your hands. Stay home when you're sick so then you're not infecting other people. Get your flu shot. Make sure that you practice good cough etiquette. If you are out in public, where if you are coughing, you actually cough into your arm so then you're not exposing others to your cough or even your sneeze.
Okay. And so we have I know that we're hearing about the various screenings taking place up and down right now as at airports and such. What's happening right there?
Yeah, so the Centers for Disease Control and Prevention initially listed three airports as sites of screening. So they were San Francisco, Los Angeles, LAX, and JFK over in New York. And then last week they expanded to two more, Chicago and Atlanta. And as recently as today, the expansion is to 20 total of airports and also land sites, meaning if people drive in from Canada and if people drive in from Mexico and who qualify to be screened will be screened. And if they display any symptoms of fever, cough, difficulty breathing, and they've recently been to mainland China in the past 14 days, they would be screened by medical experts from the Centers for Disease Control and Prevention, and then quarantined if they are symptomatic. And then if they are not symptomatic, given a traveler card to keep with them. And on that card, it tells them that if you develop any of these symptoms, to contact a doctor right away, not to come in until the doctor gives you direction. And then after the doctor contacts the local health officer, so say in the U.S. Sutter County would be me, then I would work with that doctor to decide if testing's needed and in what capacity and at what location. And then the testing sample would then be sent to Atlanta, Georgia at the CDC.
Okay. So those are the processes essentially that we're talking about here. But how do you feel about the efforts of the local, in the United States, the health community responding to this and the CDC?
I feel very happy, and I think that the CDC, the state, and the local jurisdictions have been doing a really good job. So case in point, yesterday I was on a conference call with the Orange County health officer and the LA County public health staff, and they said that they are very confident that there are 2 cases, one in Orange County, one in Los Angeles County. They caught them very early. So these people were visiting from China. They were immediately identified at the airport, screening, so they had no opportunity to be mingling within the general Southern California communities. And then they were immediately evaluated, tested. As you all know, the testing confirmed the positive coronavirus, and then they have been immediately quarantined, and their close contacts, meaning people who travel with them and or their household contacts, are being closely monitored for signs of symptoms. And as of right now, there is no indication that there's community spread even among the close and household contacts of those 2 cases in Southern California.
Okay, and we have a couple comment. I know Valley, who used to be with Health and Human Services in Yuba County, has expressed her appreciation. Brittany mentioned the volume, but we also encourage any questions you have. We're going to be on here for a few minutes talking about this. If you have any questions, please type them out. We'll try to monitor them at this end and pass them along for both Yuba and Sutter County as you come along. If you're able to get on, we would love to answer any questions that folks have. I want to say any rumors out there that you're hearing that you'd like to address regarding this.
Yeah, so I think that a lot of anxiety centers around the belief that they need to start wearing masks, whether it be surgical masks or N95 masks or goggles, face shields. That is not necessary. The best mode of protection is that, one, you make sure that you wash your hands, because a lot of the time you'll know if you're going to be around someone who is coughing or sneezing, but you don't pay attention to the surfaces that you touch. And then you touch your eyes, and you touch your nose, and you touch your mouth, and that's how most people get sick from viruses, whether it be the common cold, the flu, or as in mainland China, this coronavirus. And then the reason why CDC, the state, and I have advocated for getting the flu shot is that then it eliminates any ambiguity, whether these symptoms, if you start having a cough or a fever, is this the flu or is this coronavirus? And it also helps your doctor. So when you call your doctor, in addition to writing your symptoms, any travel history, any exposures to someone who has traveled to mainland China, you can say, Doc, I also already got the flu shot. If you haven't, that's when the doctors say, you know what, common things being common, it likely is the flu.
Can you, kind of circling back, could you just tell us briefly what the coronavirus is, and maybe how it differs from the common flu?
Yeah, so this new coronavirus is one of many. So there's many different types of coronavirus. So back in 2002, 2003, the SARS virus was a coronavirus, and then most recently, several years ago, the MERS virus was also a coronavirus. How we suspect this virus occurred, just like with MERS, just like with SARS, is that there was close proximity of humans with live animals. And in the case of this one, it was proximity at a wet market in Wuhan, China. and then it jumped the species barrier. Essentially, a virus that's been circulating in bats and other live animals, usually not hurting them, but then the virus then jumped over to humans and it's now hurting and affecting humans. There is limited person-to-person transmission. We know that, but again, this is in mainly close contact. So someone who's very, very ill and is people who live in the same house as them, or people who have interacted with them very closely within 6 feet or shorter for long, long periods of time, like hours at a time. This is not people where they just, passed by and someone coughed on them.
Awesome. And can you also talk about just how closely you and other local public officials are paying attention to this? It sounds like you're talking with, health officials down south, so.
Yeah. So we have weekly calls with the Centers for Disease Control and Prevention every Monday for all local health officers throughout the country. So we hear from anywhere from Washington State when the first U.S. case came in. We also heard from Chicago. And then as recently as yesterday, the state of California has instituted a weekly call for just California local health officers.
Awesome. And I guess any concerns about just the common flu? Was this flu season in particular severe, normal?
So it's a little higher than expected. So we're in sort of peak flu season. So that's why it makes it really challenging for overall. So as of this, which is January 29, 2020, there's been 15 million people in our country who's been diagnosed with flu-like illnesses. Out of that, we've had multiple hospitalization, up to like several 100,000, and then unfortunately 8,000 deaths just related to positive flu.
Okay. And any other words, any other last thoughts on this particular topic that you want to encourage people about, or even warn them about moving forward as we look forward to the next? This will probably go on for weeks now, still, as far as our concern goes with this flu season.
So I really want to advocate that right now the situation is serious globally for the coronavirus, but not in the Yuba Sutter County region. So your best bet is get your flu shot, wash your hands, stay home if you're sick, and then if there's any risk that you have been exposed to someone who is sick, has recently traveled to mainland China, or you yourself have recently traveled to mainland China and become sick, please stay at home right away. Contact your doctor right away. Don't come into the clinic so that you reduce the risk of infecting others. And then your doctor will guide you on the next steps, and all of the physicians and medical providers in the Yuba Sutter County region know who I am already and know to contact me, and I can be that link and that help them with the decision making about testing or not, and then helping them to send the samples to CDC.
Okay. In terms of questions that we've had from folks, we just had one that there were two questions, I guess, here that one was interested in the Bacchai Festival. Which has the cultural, the Chinese culture and influence in this, especially in the Marysville community and such, and that it brings people from the outside into our communities. Should there be concern, or is it pretty much what you were saying before, just the precautions that everybody should take?
I think it's just the precautions, as you noted, Russ, and I believe that the parade is still about a month away, so February 22nd. A lot can happen in the next month, but as of right now, the recommendation I have is consistent with that. If you know of someone who has recently traveled to mainland China and they are sick and they're planning on coming over, whether it be from the Bay Area or from Southern California, I would advise them to check with their doctor first. and that really eliminates any concern about them exposing others in the community. But that is a general recommendation, and not just for the parade, but overall all public gatherings, whether it be going to work, going to school, and going to the mall even. Yeah.
Excellent. Well, the communications teams from both Yuba and Sutter counties are working together to see if we can get regular messages out from you to the community and so maybe let's step back for a second. Let's just talk about your role.
Yeah.
What help the community understand what is your role as the health officer for these two counties?
I think the easiest way for me to describe my role is I'm the doctor for 175,000 people in the Bi-County Yuba-Sutter region, meaning that you all have your individual primary care doctor, but my role is to communicate for you in a timely and concise manner public health issues that are of concern to the community. My role is to serve you all, to listen to your concerns and try to work with my colleagues in both counties, especially in the division of HHS, to address them in a way that will make the Bi-County region safer, healthier, and happier.
Excellent. So if I have a rash on my shoulder, I shouldn't contact you.
No. But I think that it's best that I am looked at as the educator of medical issues. If you say, should I really get preventative cancer screening? I'm gonna say yes, but I'm gonna try my best to explain to you why. Like, why do you need the pap smear? Why do you need that colonoscopy? And really explain and distill for you in layman's terms so that the community can understand.
We do have one last question popped up really quick as related to the coronavirus. Can that coronavirus be transferred within mosquitoes?
No. So the virus is not using any type of animal as a vector form. So this is not like Zika. This is not like dengue fever. This is not like chikungunya. Not even like malaria. So right now, the transmission is through respiratory droplets. So someone sneezes on you, someone coughs on you, and they have to be sick first. So a person who has coronavirus is symptomatic, and then through the respiratory droplets that you then inhale through the orifices of your eyes, your nose, or even your mouth, and that's when the viruses are then internalized to your body.
Thank you, Steve. That was a good question. Actually, that helps clarify things. So anyway, any other questions you have?
I don't think so. Any final thoughts?
No, besides the fact that please refrain from being anxious about this, even though I know that it sounds very scary in the national media and the global media. This is a very serious global issue. In mainland China, it's a big public health concern, but as of right now, for the Yuba-Sutter County region, our risk is very low.
Well, thank you so much for taking your time to talk to our residents, and we're looking forward to talking to you soon.
Yeah.
And welcome to the Yuba-Sutter region.
Yes,
We're really happy to have you here.
Yeah.
All right. Thanks for tuning in, everyone.
Thank you, Yuba-Sutter. Take care.